Hey guys, so this is if you failed our low back mobility test. This is your exercise prescription. So the test was to touch your toes. So if you have problems and you're bending your knees, the first one we're going to show you is just how to foam roll your hamstrings. So you can take a foam roller or even the supernova ball. Just going to put it underneath that hamstring. Same principle applies. 20 seconds of a roll, you can cross your other leg over to get more pressure. I like to do that, or even side to side. Just trying to get pressure on those hamstrings. Find those lumpy, bumpy, sore spots and hold pressure. So you can do the same thing with that supernova. And this one gets in there, I think, a little bit better actually. Really kind of generates some good pressure and a little bit deeper. So same thing, but that's a supernova, or you can get a softball. The next thing you're gonna do is work on your low back. And you're gonna put this ball right next to the spine and the low back. So the cross ball here. And you're just gonna hold pressure on there. Same thing side to side, up and down. This is a really good one for anybody with low back pain, get stiff out of the bed in the morning. This is a really good go-to one for people with lower back issues. And now also, you can use, we wanna work on the glutes. So foam rolling, if you're doing your hamstrings, you can just work a little bit higher. Now put this kind of right on that glute. And same principle, up and down 20 seconds, side to side 20 seconds. Keep working those lumpy, bumpy, sore spots. I really like the foam roller for that area. Now, if you're having problems in your lower back, if your pelvis is tilted forward a little bit, if you're having that pain in that extension test where we were reaching back, what you're gonna do is take the supernova ball, you're gonna put it into the psoas muscle. This is one of those muscles that often gets used but never massaged. So it's basically 1 inch out from our belly button on either side, and it goes all the way on the inside of that femur, and when it contracts, it flexes our hip. So we sit a lot and we get tight hip flexors, and it really wrecks our lower back. So you're just gonna kind of put that ball right into the meat of that psoas, and you're just gonna lay on it and kind of marinate. Just kind of do this, prop up on your elbows until it's comfortable. Then you're gonna flatten out. Same thing, a little side to side, a little up and down. And as those spots start to get a little bit less tender, you're gonna move up and the ball is gonna move down, and it's gonna start to get inside of that hip. And then you're gonna frog leg that hip, and you can really get inside of that psoas where it inserts. And that's one of my favorites right there. Hold some pressure side to side. This one, for anybody who's sitting like, more than 3-4 hours a day, is a must to really soften up those hip flexors. And I'm gonna switch spots with this beautiful camera lady here. And I'm going to show you the last one. This is really good for lower back. If your lower back is sore, if you have some disc issues, you use that heavy, 150-pound resistance band. Little guy, took one in the eye. Is it okay? You're going to strap this around your knee, lift your leg over it, get it right in that upper thigh, and you're just going to lay back and enjoy that self-traction. And just kind of hold it, and you'll feel a nice pull. And this one is super duper comfortable. If you have any pain with it, any radiating pain, I would stop doing it. Use your own discretion. But this is a really good one for anybody who's got a lot of compression in their lower back or disc issues. So that's your mobility prescription for the low back.